Great. Oh, it's not letting me in.
Wait for people to get online. We're still a few minutes early here and looking forward to a terrific conversation with all of you. Thank you for joining us, and we'll be with you in just a second. We still have 2 minutes to go by my clock, at least. So we'll still wait. If people are assembling, we're getting a great group, and we'll give folks just another minute or two to assemble, and then we'll begin our program. We're looking forward to a terrific conversation. Be with you in just a minute or two.
Sure. Thank you.
Well, good afternoon, everybody. We have all of our speakers assembled, and we have a great group of folks who are coming online, and a few more to join. And so I think we can get the program going here for what promises to be just a terrific conversation on future of health systems in Latin America and the Caribbean. Boy, that's a grandiose title, isn't it? The future of health systems. And we're going to answer everybody's questions on those issues in the 2 hours that we have this afternoon. But all joking aside, this is a really important topic that is occupying the minds of many, many very smart people coming out of COVID-19. The region, as well as the entire world, is not probably going to be doing things exactly the same as what was being done before COVID-19. And one of the areas that we believe will have significant changes, we're going to hear about that this afternoon, is the whole telemedicine space and the delivery of medical health and healthcare outcomes. My name is Eric Farnsworth. I'm the Vice President of the Council of the Americas and the Americas Society. Privileged to be your host this afternoon and to welcome again all of you to this session. We have a terrific lineup of speakers. We have 6 panelists, and so what we've decided to do is divide them into 2 one-hour panels. The first panel is going to be 3 leaders from the private sector. The second panel is going to be 3 leaders from the public sector. I will moderate the first panel, and my colleague Zoe Douth, who coordinates our healthcare activities, will moderate the second panel. And we are delighted to have such a Roche Latin America. He's the area head for Roche Latin America. It will include Fernando Pedro, who's the Chief Medical Officer of Amil, and Hugo Villegas, who's the President for Latin America of Medtronic. And Hugo is also on the board of the Council of the Americas, and he is the co-chair of our healthcare group. So it's a delight to welcome all of them. And then the second panel will consist of James Fitzgerald of the Pan American Health Organization, Felicia Knoll of the University of Miami, and Fernando Regalia who's the chief of the Social Protection and Health Division of the Inter-American Development Bank. And Zoe will do introductions of all of them. Before we begin the panel, I do want to thank the sponsors of our healthcare activities. We have very generous sponsors, Sanofi, Pfizer, Merck, and Roche. Your support is meaningful and allows us to focus on these issues in a very significant, incredible way. And so we continue to value. Everybody should be on mute. Please make sure that you remain on mute so we don't hear barking dogs and telephones going off in the background. I know most of us are working from home. That's the downside of doing so, but please keep your mics on mute. To the extent that you have a question, would like to get into the conversation toward the end of the hour, when we have time, you can either send a direct chat to me, or you can send a direct chat to Zoe Douth, or you can send a chat to ASCOA host. Any of those would work, and we will attempt to call in as many folks as possible in order to do that. And also those of you who are following this on Twitter or would like to, the hashtag is healthcareASCOA. That's hashtag healthcareASCOA. And of course, our Twitter handle is @ASCOA. And we encourage you to do that because this is an on-the-record program. And so we're very excited to have that opportunity. Well, because our time is short, we're going to jump right into it. And as I mentioned, our private sector panel is going to occupy the first hour and the opportunity for those on this WebEx call to ask some questions as well. The order that we're going to do this is Rolf will go first, and then Fernando, and then Hugo. So Rolf, if you are ready, we're going to start the program with you, and I apologize for the telephone going off in my background, but Rolf, this is to you. So please get us going, and thanks again for joining us.
Thanks a lot, Eric, and thanks a lot for this opportunity and for the invitation and the possibility to participate at this panel discussion about the future of health systems in Latin America and the Caribbean. And I think definitely, if we think about these unprecedented times that we pass through and how many lessons that we can learn from this situation, I think it's amazing. And as well, thinking that we're doing this kind of a panel discussion from our homes in different parts of the world. And as you say, so if there are some dogs barking, that might be mines that just pass by, I think the pandemic definitely puts us puts the health systems on enormous pressure, and I think you have seen the capacity that issues that actually exists, and that highlights the lack of infrastructure, the lack of access that the entire population have to quality healthcare. And I think if you look at this relatively low investment levels that we had for many years, I think they show just up in the deficiencies. And I think many countries in our region, they have just gone very early into prolonged lockdowns because they knew they couldn't cope, their systems couldn't cope. And I think you see this, that I think even by doing this, they're going very clearly, very close to the capacity levels that we have now, like, for example, in Peru and in Chile at the moment. No? And that, I think, it's a consequence of the relatively low spend that we have and Pao shows that it's 4% of GDP for public health, and I think this is definitely half of what the industrialized nations spend, and even if you then think about what's the GDP level as well. So I think this is just a part of what we face. Now, on the positive side, I think what I see is an enormous resilience and willingness to collaborate, because I think you have seen different actors of the health system working together. And I think there are certain lessons that we can bring there and opportunities for, so to address these infrastructure changes. I think for me at Roche and in the area of Latin America, I think we really think that we can play a significant role in transforming healthcare. And that means by working to bring innovations to the patients, to the test centers, as we are both in diagnostics and in pharma, and this at the sustainable cost to society. But I think as well, a point that we need to think about is how do we overcome these structural limitations that exist in healthcare. And what I'm thinking here is actually the crisis that we're living through is not only about the patients of COVID, but there is an enormous problem with the chronic patients and the continuity of treatment and the diagnosis of new patients so they can be appropriately treated. And I think there is a lot of costs of the healthcare system actually hidden at the moment of all these patients that are not treated or not diagnosed correctly. And I think these are issues that exist around the world. It's not only in Latin America, it's around the world. But the more vulnerable a health system is, I think it's just getting them stronger. And that, I think that leads me to one of the lessons that we learned in the recent week. And I think it's, if we look at the digital solutions, so the potential of digital solutions to overcome healthcare crisis or these healthcare barriers. And now, obviously, one thing, and I will come back to this, but one thing that I immediately ask myself is, okay, what do we need to do in order to adapt legislations, regulations, so that as well in more normal times, we can actually enable these learnings of the pandemic in order to improve the healthcare systems now. And I think you obviously think about telemedicine, electronic prescriptions, teleeducation, geolocation that is now, I think, as well fashionable. So I think this is all things that have come. I was lucky to see as well our employees and as well myself to participate in a couple of hackathons where we worked on solutions. And it was very, very interesting to see how these collaborations as well with startups can emerge and where we can actually work together. And I think that's for me the biggest learning. So how can we together work to imagine this future and build that future by these public and private partnerships, and to make sure that probably these digital health learnings that we had can be reality. And as I think this, we can probably improve or close the gaps in health equality that still exist many of the reasons in the region. Let's stop here.
Very good. Thank you very, very much for getting us going so well. And I neglected to mention in my introduction, for those of you who are looking for the biographic information of our panelists, we're not going to go into it here because we don't have the time, but it is available on our website at the link to this program. So we encourage you to take a look there. Rolf, thanks for getting us going, raising some important questions already right at the very beginning of this conversation, as we knew you would. So thank you for fulfilling your duties so expertly, and we'll come back to you to follow up with a couple of those thoughts. We're going to go now to Pedro. Fernando, all the way from Brazil, but in a virtual reality, what does that even mean? We're delighted to have you with us. Over to you, please.
Thank you so much for the invitation. Good afternoon, everyone. It's an honor for me to participate and contribute in this discussion. My name is Fernando. I am the Chief Medical Officer of Amil, which is one of the largest healthcare providers in Brazil with more than 30 hospitals and outpatients units. I lived in São Paulo, and my parents, aged 70 and 77, belong to the high-risk population of COVID-19. Both have been in home isolation since February, when there was the first confirmed case in Brazil. They do not receive visits from their grandchildren and children. They go to the supermarket at predefined times for the elderly population, and they have canceled all scheduled medical appointments to monitor their chronic diseases due to the fear of being contaminated and needing hospitalization. Like my parents, there are thousands of high-risk patients in Brazil and worldwide. How have we therefore addressed the needs, expectations, and consequences of the direct and indirect effects of the pandemic? At Amil, since the first crisis committee in January, we have been working tirelessly to anticipate the challenge that we can possibly face. It is also worth mentioning that we have clients throughout the national territory, from Amazon, where the pandemic grew rapidly, to South states, where growth was slower. We needed to make quick decisions, communicate clearly and responsibly internally and externally to ensure quality and safety in the provision of the medical care for those we serve in these pandemic times. Prepare our hospitals and align with contract network hospitals to increase ICU demands and emergencies. Protect the population at risk and ensure continuity of treatment of conditions not related to COVID in situations of isolation, since people, especially the elderly, are locked at home for fear of contamination. The pandemic scenario did not give us the privilege to slow down and find and implement solutions. We are in a moment to test and roll out integrate strategies. Digital solutions have been a key element in keep clients and users in all sectors closely connected: homeschooling, home office, and telemedicine. In a way, Amil had already some health solutions underway, and the pandemic accelerated these changes to reduce the impact of the pandemic crisis on the people we serve. Telemedicine, for example, was available as a pilot program to slow some of our clients since July last year. However, in March of this year, we quickly expand and modify this digital tool to provide access for our 3.6 million members across the country. The company has accelerated investments in remote services through a solution developed by our IT team to collaborate to the reorganization of the health system, which was abruptly modified by COVID-19. In these first 60 days since the implementation, we have attended over 30,000 telemedicine appointments in 5 fronts: assistance for situations of relative urgency, care for mental health situations, monitoring high-risk population, monitoring health professionals from our hospitals, and elective patient care for some specialties. There's a lot of potential to be developed by this disruptive digital transformation. Telemedicine has allowed us, even the quarantine period, to stay connected and integrate with our stakeholders. The digitalization process has empowered our clients by increasing the health engagement. So for now, my parents and many others still can't see their children and grandchildren, but telemedicine allows them to remain connected with the healthcare system. From the physician's point of view, we have noticed a high rate of adherence to the new tool. These professionals, in addition to the comfort of being able to work from home, have expanded their market through their training to ensure alignment between clinical knowledge and humanized care. The advances obtained by the results so far with this disruptive transformation have enabled us to vision new possibilities to leverage the operation with new partners in a collaborative and transparent manner. Moreover, telemedicine can accelerate the development and the use of analytic tools to recognize standards with respect to data privacy laws that will contribute to improving the health of the population and increase the efficiency of the care. The crisis has given all of us an opportunity and privilege to create solutions which can contribute to the health industry even after COVID-19. Amil is open to collaboration to promote the sustainability of the health system, public and private, so that it works for everyone. This is my first thoughts, and I'm glad again to be here. Thank you.
Fernando, thank you very much. And I got to say, again, an outstanding presentation. Both of you have already referenced the indirect impact of COVID, which is to say, there's a whole lot of underlying other health issues that existed obviously before COVID, but COVID is also exacerbating the impact of those, and that's a really important point. You've also mentioned mental health, and I think, with everybody in isolation for months at a time, that is an issue, and I'm not sure this panel, we're going to have the ability to get into that particular issue, but that is a huge issue and something that I'm really glad that you mentioned. So both of you getting us going so well. Hugo, you're filling some big shoes here, coming bat and clean up on this panel, but if anybody can do it, you can. And I understand you have some slides to share with us as well, so the floor is yours.
Thank you very much. It's great to be here. Thank you, Aaron and the Council, for the invitation. I don't know, Sue, I don't think I'm able to share the slides from here. Are you going to help me with that?
Yes, we are. And I believe Marvin is, yep, here we go. So we're a well-oiled machine, Hugo.
Okay, great. Just a couple of words about who Medtronic is. Medtronic is the largest and most diversified medical technology company in the world. And as being a leader in this area, we certainly think we have a key role in the future of healthcare after the COVID-19. I'm very convinced that this dialogue is the kind of things we need to do to really shape the future for the better. Next one, please. I'm going to divide my 5 minutes in two pieces. One is how Medtronic had responded to the crisis, and finally addressing the theme of our WebEx is to address what are our hypotheses about the future and what is going to change and what is the healthcare in the future. And I'm very glad to see we have a lot of alignment with my two predecessors on the video. So first of all, we very quickly identified the 3 priorities we're going to be doing while the crisis is going on. Immediately we saw it, and also how we're going to be managing the company in the future. The first and most important out of all is certainly our 90,000 plus employees. We wanted to make it sure from day one that we were caring for their physical, financial, and emotional health. And that has been our priority so far in the company. Then making sure we deliver on our mission. We have a 4-tenet mission, but probably the overarching phrase is to make sure that we alleviate pain, restore health, and extend life to those patients more in need today of the COVID. And last but not least, making sure we do our parts in the community to try to stop the spread of the virus. What we did is to immediately dictate work from home for those who could work from home, extensive preventive measures in our manufacturing facilities. And we're happy to say today that all of them continue to operate at full capacity, and very strong focus on providing safety and clinical support to the procedures in hospitals that needed to be conducted while the pandemic is going on. And last but not least, the philanthropic piece that we've been also working on to make sure we give back some of what we really receive by driving this company. Next one, please. We are one of the leaders in the world in terms of ventilation. We have our ventilation line, as you can imagine. That's one of the biggest constraints healthcare is having today in the pandemic. But since we started in February, we have been able to triple our vents production in Ireland, in Europe. We also released the patent of one of our ventilators, and more than 100,000 companies have gone in and tried to build ventilators out of our patent release, since we saw we couldn't cope with the kind of demand, so we opened it up. And also a lot of collaboration with many other key stakeholders like Tesla and SpaceX, helping us build rapidly parts of parts of the ventilators that we have. That has been a titanic job, but I think we feel comfortable. We tripled that in only a couple of months. And then how our employees certainly are the center of the pandemic. It's been a non-stop in our manufacturing facilities, supporting not only the clinical procedures, but also the operational events and all the equipment we have additional to the vents in terms of the ICU. In terms of philanthropy, we have given more than $13 million so far, and we're sponsoring our employees from a 1 to 2 match if they choose to donate something locally in an eligible nonprofit. And finally, last but not least, as a leader in healthcare, we are committed with the community. We created a voice of the customer community composed of around 200 hospitals and 1,100 physicians, where we get information about what is their reality and what are their needs and how can we help them to get out of the crisis and make it better for the future. And we have built a lot of educational trainings with employees and certainly with physicians, mainly on our ventilators and other therapies that we have. And we are also making sure that we have our priorities very clear. I think we heard from our partner from Amil that one of the biggest challenges we're having is that patients are not feeling comfortable to go to hospitals to treat their chronic conditions. We have called it internally the COVID phobia. So we created some panels and webcasts amongst hospitals to share best practices of how we give confidence to the patients that they can go to the hospitals and make sure they're not going to get the COVID-19 by going to the right places and making sure the hospitals find the right care path to avoid further contagious. Next one, please. Finally, I think the future is all about adopting and adapting to a new role, what is being called the new normal. And I've dared to put on the screen 4 pillars for this: the power of technology to save lives. I think with evidence that technology makes a big difference in order to save life. Companies like Medtronic now more than ever will continue investing in R&D and making sure we have top-of-the-top technology to treat not only this pandemic, but more to come, which I think we all agree this will not be the last one. We've been talking about telemedicine and the acceleration of the remote driven healthcare. We've heard from my 2 predecessors about all that. And I think it's been a reality, and the acceleration is going to make a significant difference. So that's also another very key important option, and also a lot of the trainings that go on. These medical congresses that we do in different cities all over the world in different specialties. Most of them are going to be conducted virtually. That's one of our bets, and I think it's going to be great for the economy and in terms of the savings in traveling and all that, but also for the balance of personal life and work, avoiding all these physicians traveling so far to assist or to attend a Congress. And finally, I think it's very important that we align the value through innovation and new business models. And this is very, very key because, we have sometimes we have evidence that we have conflicting interests and conflicting rewards in healthcare for all the stakeholders. And certainly we need to take and adapt and change the business models that we're having, following best practices, providing evidence and assistance to be more efficient in terms like managing inventory, forecasting, creating innovative payment options that reduce the cost of healthcare and improve the quality of healthcare that patients are receiving. As an example, how can we partner and create a risk-sharing project that at the end, the patient is whatever the benefit of the patient is, all the stakeholders will benefit on how the patient does, instead of just putting cost on the system, which everybody loses. And last but not least, the leverage, the breadth and depth of boosting collaboration. I think we in Medtronic have a role to play in that sense. We want to get together on the same table, patients, providers, payers, and the industry, to talk about how to align objectives and how to align rewards to all of those three, to make sure the patients is well served at a low cost, or at the lowest cost possible with the highest quality possible. We talked about private and public partnerships also, and also private and private partnerships, to work on this, what we've called the silo breaking approach to healthcare. That it is really evident in different countries that the pandemic that has made us aware that we need to work together for the same purpose and for the same endpoint. And if the system and the patient does well, we all stakeholders in the healthcare system should do very well. So we've seen some alliances, we've seen some teamwork in the last probably 8 to 10 weeks, but our bet is that certainly we're going to see more and more, and these partnerships are going to be very key for the future, trying to have trust among the stakeholders and making sure we align interest. So Erin, that's all I had as open it up for discussion.
That's fantastic. Thank you, Hugo. And again, all three panelists have done a magnificent job of setting the table for us. We have a lot of time to discuss these issues in greater depth. And I want to get right into that with Roche to begin, with Rolf. All of you have mentioned innovation in some form or fashion. All of you have mentioned partnership, willingness to collaborate. And I wonder, Rolf, you actually mentioned legislation and regulations, and without going into specifics, perhaps, are there things that you've seen across the region of countries who have been doing things, quote unquote, well, that are best practices that are really helping to unlock some of this innovation that clearly the private sector is looking to try to collaborate on? And to the extent you're willing to name some of those countries and give us examples, that would be tremendously helpful.
Yeah, probably. I think we have seen some great examples of at least temporarily release telehealth possibilities, and I think that's fantastic. I can only show you or can mention about a couple of examples where we collaborate. So obviously, and I think this is important. So in some countries, for example, we have tried to use infusions or at home, because if the people are afraid to go into the hospitals, and I'm not going to name, but so it's about 4 or 5 countries where we have tried to do that, and it actually works. So we bring the infusions actually to the patients' homes, or in other places, what we are doing, we actually partner as well and bring safely the patients to the treatment centers. And I think that's something very important as well. So because some treatment centers, they don't treat COVID patients, so they would be safe, but the transport is not safe. So we analyzed it, and we decided that we provide the transport. But on the other hand, I think you have an example, and that's probably a named country. It's in Peru. We work together with Alafarpe, the National Pharmaceutical Industry Association, and together in partnership with the Ministry of Health, what they have is the first telemedicine app, mobile app that is created with public and private, and I think it's called Smart Doctor, and it supports patients with chronic diseases, and so that they get the monitoring, that they get the localization, and you actually can, with this, ease the communication ability to provide a better case, a better study for them. Or another is something that we try out in Chile with the National Cancer Institute, so in cancer. And there it's another startup that we partner with, and the startup is called We Care For You. And there we developed a digital tool to provide remote monitoring for cancer patients being treated by the Cancer Institute. And I think as well, why do we do that? Because if these patients know that we can, on a distance, monitor them, so they can get, then actually it allows them not to go to the hospital and potentially get infected. And I think this kind of collaborations is what I see. And I see an interest of the ministries of health in order to support us in this direction. I think that's a very, very positive development.
Does some of this require, Rolf, actual changes in legislation and regulations, or is it something that could simply be implemented with a different prioritization in your experience?
Well, I think there are some of them that actually need a change, because I think you in several of the countries you still face limitations, for example, for an electronic prescription. So, so you can make the teleconsultation, but then afterwards, okay, the doctor, and then that this is a valid prescription to go into the pharmacy and then as well for reimbursement. So I think there are changes that needed. And you know, in an emergency, in a war zone, basically, they probably accept this. But then afterwards, when we get into together normal, which we actually showed that this is a better health system, this is actually more effective, then whether that's sustainable when you get out of this crisis situation, that's probably then the big question. And I think there we have to work country by country and to make sure that these advances that we made during this period actually are sustainable.
Yeah, and I want to use that as a segue to Fernando with exactly the same sort of question. You know, there may be a temptation, at least in some quarters, to try to return to the pre-COVID environment and try to address all the things that were previously existing. But I wonder, Fernando, from your perspective and from the perspective of your business, how are you looking at the current crisis in terms of reformulating what you're doing to look ahead, to take advantage, if you will, of some of the positive things that we've seen? And I'm not talking COVID is positive, don't misunderstand me, but there are some best practices that have come out of this. And how are you beginning to incorporate those issues into your own line of business?
Yeah, first of all, I think during this pandemic period, it was a huge opportunity for us accelerate changes that we have already in place. You know, as I told you before, we have already telemedicine as a pilot project with a hospital provider to work for a few small part of our population, and that we leverage for all those our members, 3.6 members around the country. So in Brazil, the Medical Council has released us to work telehealth during the pandemic situation. And I do believe that during this time, there are so many stakeholders and there's so many data that we can discuss, that possibly we can identify ways to make it in a more safety and provide quality for the patients. One thing that I believe is the main concern is to, okay, since you have a digital tool, you can provide telehealth. So how we can regulate, how we can make it easier that we can provide access, but in a way that makes sense for the whole health system. And during this pandemic period, we have collected a lot of data. And since we implement telehealth, daily we are learning new possibilities, how to engage the patient in these new possibilities. And we are open for a mature discussion in Brazil to help to identify opportunities to leverage this tool, and how to not just the public, but not just the private, but the public service, to really create value for the health industry in Brazil. You know, not just improve patient experience, not just enhance quality of care for these patients that we receive, but creating improved experience that will help to achieve more educated patients to can manage their health more effectively. They can empower about their health and ensure a cost that driving down, since the quality is not compromised. So I think all this situation has allowed us to have a more but mature discussion with more data about future and next steps.
Thank you, Fernando. And just a program note for those who may have joined us a few minutes after the hour, the second panel will feature our public sector representatives, so stay tuned for that. But Fernando, one additional follow-up to you. I mean, Brazil is a massive country geographically and culturally and everything. And I wonder, in the strategies coming up with that you're implementing, what sort of regional differences you might be seeing, or are there some, I mean, is an urban environment more conducive than a rural environment? Or, I mean, can you help some people who are not experts like myself to understand those particular issues a little bit better?
Just make me sure. Yeah, we has continental extension, and as you I don't know how close you are to the news regarding Brazil, but we have different scenarios here like São Paulo and Rio. They are the biggest cities where we start the pandemic scenario here. But we have, again, Northeast. And then after São Paulo and Rio, the pandemic was to Northeast, and they have fast growth of these things. The fact that as Amil is working national, we are be able to provide access for the patients across the country. I can tell you an example that we had a patient in Amazon. She was 200 kilometers from Manaus, and the only thing that she has that is a iPhone. So the only way to connect to doctor is to be a phone, and the telemedicine could help her to address their needs, to reduce the anxiety from her and her relatives. And so as we can increase this access, we can really improve outcomes with our members.
Yeah, I think that's the key point, is that through telemedicine, I mean, geographic distances almost, shrink to be imperceptible. And the model perhaps works everywhere. And I think that's a really important point. Thank you for emphasizing that. Hugo, let's go to you for first round of questions. You are the world's largest medical device company. And so you obviously have global insight as well. But I wonder, from the perspective of the Western Hemisphere, Latin America and the Caribbean, how this is beginning to affect your actual business model for the region. I mean, you spoke about it a little bit in your introduction, but how are you beginning to think about the whole Latin America and Caribbean space as a marketplace in the context of post-COVID environment and some of the opportunities that might arise there? In other words, is this an area where we should anticipate a lot of investment that is focused on innovation? Is it more of the same? I mean, help us think that through. What can we anticipate from the private sector perspective?
Yeah, thank you, Aaron. I think it's a great question. I would answer it by saying yes, we've seen significant changes in the market drivers, and I mentioned a couple, but I'm going to reinforce, the importance on continue investing in innovation and making sure we have the top of the top in terms of medical technology. I also mentioned about changing the business models. I think the traditional business for a company like ours to just produce an element or equipment or a medical device and I sell it and then I charge for it, I think there's going to be part of the past, because there's going to be a lot of more need of healthcare with limited budgets. So I think we also need to better align our objectives and only get paid. And I'm talking about not only medical technology companies, but the whole stakeholders in healthcare. If the patient gets well, if the patient gets the right treatment, and in order to keep costs down, I also see and expect not only the short term, you're seeing additional investment in healthcare. And that's one of the things we're seeing positive. I think governments, and I heard a couple of presidents in Latin America saying, I realized my funding of healthcare was never enough to make sure we faced a crisis like this. Much less people would have died if we had more and better equipped in Latin America, and that's going to change also the funding for Latin America. And at the end, the collaboration amongst all of us, I think we realize how vulnerable we are, and we also have become more sensitive to my neighbor's needs, and at the same time sensitive to my partner's needs. Say, call it a physician, a hospital, or a payer. I think that will allow us to come into terms much easier than in the past, to build projects together, to go into schemes like risk-sharing, which in the past, the lack of trust among the stakeholders have been an uphill task. And I think this crisis opened the minds of all of us to make sure that we work much more together than we've done in the past.
Yeah, absolutely. And we're going to open the line just in a minute to our first question from Cecilia Sanchez. And Cecilia, I'm going to go to you in a second. But Hugo, just to follow up what you just said, you just hit a key issue, which is the whole financing side of these issues. And even before COVID, it was a real issue, no doubt about it, in terms of national budgets and things like this. And coming out of COVID, you're going to have a region that is going to be desperate for financing, just for basic economic recovery, not for anything, not healthcare or something else. It's just basic economic recovery, and budgets are already going to be strained. And even before COVID, of course, regional growth was projected to be just barely positive across the region, with some divergence, of course. But I guess in that scenario, governments are going to be looking to the private sector to collaborate and to help, but there's going to be a lot of cost pressure involved in that. And of course, Latin America and the Caribbean are not unique in that perspective. But from a private sector perspective, from a business person's perspective, how can we begin to look at some of these issues? Because everybody's going to be having significant, desire to get at the same limited pot of funds.
And that's a great question, Aaron. You've said it. We cannot afford to continue operating as we were.
Yeah.
I think we all need to be much more efficient in how we manage our budget. And when I say manage our budget, improve our processes within hospitals, improve the patient pathway, using remote telemedicine to keep patients at home and not necessarily in the hospital, and those kind of things. I think payers, providers, and industry can partner together to make that possible. An example, we've seen an acceleration of one of our therapies, which is in heart failure, to have remote monitoring of the patients from home instead of coming to the hospital to get checked on how the pacemaker is doing, or whatever the heart failure is all about. And those changes will reduce cost, improve efficiencies, and also improve something which in Latin America is also a very key priority, to expand the access so more Latin Americans have access to key technology that in our countries, in Latin America, only 1/3 of Latin Americans have access to top technology in healthcare.
And that's an extraordinary statistic right there. Thank you, all three of you. I have a ton more questions, but we promised that from the audience we'd allow them to get into the conversation as well. And so we're going to turn to Cecilia for your question. If you could identify yourself, make sure your mic is open, and we'll turn it over to you.
Thanks, Eric, and thank all of the panelists. This is, obviously a huge discussion. Speaking a little bit about accessibility, I'm thinking about smaller markets, Central America and the Caribbean, and the future of telemedicine. Just wanted to pick your panelists' brains about other issues that might be restrictive, such as difference maybe in medical licensing and other things that may restrict those opportunities in the future. Thank you.
And Cecilia, if you could just tell us, we know, but the panelists, who you are representing.
I'm sorry about that. Yes, I'm from Miami Herbert Business School. We're part of the University of Miami. Thank you.
Very good. And so we'll go in reverse order. I don't necessarily think everybody has to weigh in on this question to the extent that you don't care to, but we'll take it to Hugo first. Smaller economies, financing, different regulations, some of your thoughts.
Yes, that's, when we talked about the Caribbean, it has always been a challenge how to give proper coverage to the Caribbean. Small countries and islands, and limited capacity to have a full footprint in each of those markets, which every single citizen deserves the best of the best. And I think going back to telemedicine is going to be a big thing. We also see, and we are experiencing now, we've been in a project for 6 months to doing remote selling. So we are contacting via telehealth or via telephone those small islands in the Caribbean and understanding their needs in terms of flying someone every 2 weeks to know what it is. For low technologies, therapy, I think is possible. High tech will still require the face-to-face, but I think the Caribbean is one of the pilots we're doing to see how we can serve them without so many intermediaries directly from the company on the basic needs of some hospitals. High tech will still require some face-to-face, even though we're also working on robotics. We've been investing a lot in robotics in our surgical division, and certainly this is going to booster the importance of also working with robotics, that those small countries can benefit to connect with a Brazilian surgeon and through robotics conduct a procedure in Dominican Republic or in Virgin Islands. That would be my answer to that.
Very good, thank you. And Rolf, perhaps a brief...
Yeah, I think at Roche we are probably a little bit lucky, and I actually have worked in Central America and the Caribbean for a couple of years, so I know the market relatively well. I think it's for us, we have relatively good presence throughout as well the islands, and but I've seen very early on, and that was really many years ago that I worked there, so a relatively fast adoption of tele tools or digital tools, because when they came up, I think that the connection that for connecting physicians with others, as Hugo mentioned as well, to connect them as well virtually with specialists from other, I think that's something that you see happening relatively well. And I think Cecilia asked as well the question regarding the regulatory and all this. I think we haven't seen a lot of issues there. That's basically countries that actually allow us from the pharmaceutical point of view relatively early access. So that's I don't see that this is the issue there.
Thank you. Fernando, I'm going to give you a pass on this question since you're primarily focused on Brazil, but if you care to have a comment, certainly you may, but I'm not going to ask you to if you don't want to.
Yeah, thank you for that. But I can share some experiences that we have some people in our team, they came from public services, and they have work in small communities here in Brazil. And, even though they don't have a lot of digital solutions, they have some solutions that can integrate and make partnerships with the providers and the physicians in order to provide integrate care. Certainly, you need some kind of technology, but I know that we have experience about telenurse to follow patients in right risk with chronic diseases, and you can make this by your iPhone since you have a medical record. So I think that the lack of resource probably has to increase your not expertise but versatility to try to find new ways or new tools in order to address patients' needs.
So a question, thank you for that, Fernando. A question has come in that the person has requested that I ask it on their behalf. And it goes back to telemedicine, it goes back to the cost issue. There certainly can be some savings in terms of telemedicine with, so people don't have to go into facilities in person, et cetera. But telemedicine itself also comes with a price tag, doesn't it? I mean, it can be relatively expensive, at least initially. And I wonder if you have some thoughts, again, about coming out of the crisis, how to put this in a perspective that it's seen not just quote unquote as a cost, but rather a benefit for the delivery of health outcomes overall. Would anybody have a particular thought on that question?
I probably would go to say, I think we need to first look at the value that is created and really discuss what is this value, because I think the cost is then a relative factor to it. If we manage to treat patients better earlier, probably than they would have been treated afterwards, and I think you can think about many types. But we know that a cancer in an advanced stage is at least double as expensive as one in an early phase, and so the earlier we detect patients, the better we treat them early on by distance telehealth or things like that. I think there is a huge savings there as well, and so it probably pays itself very well.
Yeah, and I think the implicit in the question is to be sure that collectively we're all focusing on the broader impact and not just the cost up front, but rather the overall outcomes of that. Hugo or Fernando, a thought on that particular issue, perchance?
Certainly, I think we're going to need some investment in technology. But if you think about what we've gone through for the last probably 10 to 12 weeks, I don't think anyone was prepared for this. We're all working from home, and technology is allowing us to do that with no problem. So some of those telemedicine do not require additional investments. You might have some needs on those areas that we mentioned about robotics and things like that. But day-to-day basics on healthcare prevention and certainly early stages of diagnosis, I don't think the investments are going to be that huge. And the impact also on that 2/3 of Latin Americans who do have access to technology is going to be huge.
Yeah. From my point of view, first of all, we have empowered our patients and our clients the way that's it's very difficult for them to abandon this tool. And I can, for instance, my example, I never work from home. I usually go every day to the office, and home office was able to create some facility in my daily life that probably I will use from now on. So, and more than access, one thing that we have already realized about telehealth is how people they are engaged about their health status. As they said, my colleague said before. Sorry. Oh, like my colleague said before, it has allowed us to make early diagnosis, to start treatment early, and this certainly will reduce the total cost of care. Other second thing about telehealth was able to help us during this pandemic period that we have certainly our ICUs and ERs full of people from COVID, but probably there would be a second wave with people that chronic conditions that with the lack of the treatment for so long time, they will come with more severe diabetic conditions, heart problems, situations that it will increase the cost after the first wave of the pandemic crisis. So certainly we need investments, but when we analyze later on the total cost of care, we are making the healthcare more affordable.
Yeah, this is a huge issue you've just pointed to. In fact, all three of you have pointed to. We're all focused on COVID now, but there's a whole other suite of health issues that have to be addressed now. And then the one somebody mentioned at the beginning also that we really haven't talked about and won't have time, but the whole mental health issues are going to be increasingly important as well, I believe. We have one final question in the time that we have for this particular panel, and then I'm going to turn it over to Zoe in just a couple minutes. But Fernando Becerra from Paho actually has a question with regard to making some of these changes permanent. So Fernando, I'm going to give you the floor if you could open your microphone and ask the question.
Thank you, Eric. Actually, it's Francisco, former Paho Assistant Director.
I said, you're right.
Yeah, Fernando, no, it's okay, no problem. It's always confused.
Correct, no?
No, but yeah, we're listening to Fernando Pedro, yeah. No, thank you, Eric, for the opportunity. I'm Francisco Becerra, based in Mexico City. I'm the former Paho Assistant Director. But I think that we have seen many changes as to take care of COVID and emergencies and setting new processes and bypassing some norms probably that were set in stone by many ministries of health or social security agencies. But how are we going to move forward into take these lessons learned of good changes into renewing processes, into renewing norms, and making them permanent for people who have better access to healthcare? And I think this is going to be a big challenge in the coming months. And hopefully everybody is keeping track of these new processes and changes that ministers of health or health agencies have proposed in the region. But this might be a big challenge and also a big opportunity as to make sure that we can emphasize these needed changes. And I think that there was something that Rolf was alluding at the beginning, how these changes are moving and facilitating access to healthcare. And I hope that ministries of health, social security agencies are looking into permanent changes. And I hope that they can move it into legal frameworks, because that's the only way that with legal frameworks, you're going to be making these changes happen. Thank you so much, Eric. You're mute.
Eric, you are mute.
Thank you. Francisco, thank you for that very much. That's a great question to end on for this particular panel. Why don't we go in the order that we started with Rolf and then Fernando and end with Hugo. We've got about 5 minutes or so, and so if we could use this as a way to capture your final thoughts as well. But what a great question to end on. Rolf, we'll go to you.
Yeah, I think thanks, Francisco, for the question. And I think to make it permanent, as you say, I think what comes to my mind as the first thing is to learn from the experience that when public and private sector actually collaborate and engage in a constructive dialogue, then I think we are all able to construct something much more powerful. And I think I think it's great the initiatives that you had, because you have a panel with the public and with the private sector. And when we connect both of them, I think then we can make a real impact to improve patients' lives. And that would be, I think, what I would say. And probably that's the invitation as well to all stakeholders to really keep this line of communication open and to continue to collaborate. I think that would be what I would say.
I will go in the same direction. There is no other way to leave this crisis better, since we are integrate in a collaborative way. We can be stronger together, because if anyone try to find an isolated solution to leave the crisis, it will be certainly more difficult. We have to find solutions that can be leveraged, since we identify partners that share the same values and the same mission, for sure.
Mute.
Thank you. I'm sorry. I was just saying that my last message when I did the 5-minute introduction was exactly the same as Fernando and Rolf was saying. Partnership is going to be key for the future, making sure we align our interests, making sure we work together to reduce costs, improve quality, and improve access. And that sounds great, but I think this crisis is going to help us get there. If we look at the past, we're becoming more, as I said, sensitive to our neighbors' needs and to my partner's needs. And I think that partnership is going to get very strong. In governments like in Spain, for example, we told the government how many ventilators we had for Spain in their 4-month period, and the government decided where they should go, not us. So those kind of things never happened in the past, and these kind of partnerships and trusting each other is going to change the way we deliver care and we manage healthcare in the future.
These are issues that are not going to go away by any stretch. In fact, they're going to become more acute, more interesting, more involved in the course of the future. And the Council of the Americas will continue to follow these issues very carefully. And so I want to thank Rolf, and I want to thank Fernando, and I want to thank Hugo for your outstanding comments, your willingness to join us today, and the ability to really learn from you collectively and ask you some questions. We hope each one of you will come back at some point to the Council of the Americas and share with us some of the key learnings that will come out of this crisis. And in the meantime, I just want to thank you again for your participation today. With that, Zoe, I'm going to turn it over to you. You've got the second half of the program. Zoe Douth, as I mentioned at the beginning, is the coordinator of our healthcare activities and is the one who put this program together and will be running this panel with the public sector. So, Zoe, over to you.
Great. Thank you, Eric. Well, you're always a tough act to follow, I have to say, but thank you so much for hosting that terrific panel. And I think you did a great job, and all the panelists, in positioning the private sector. And I think that last question just really summed things up, that together through the public and private sector collaboration, it's powerful, and that hopefully from this crisis also comes opportunity. So now it's my pleasure to welcome our esteemed panelists from the private sector. We really have a fantastic lineup of experts. We have James Fitzgerald, Director of Health Systems and Services at the Pan American Health Organization. Also, Fernando Regalia, he's the Chief Social Protection and Health Division from the Inter-American Development Bank. And Felicia Knoll, she's the Director of the University of Miami Institute for Advanced Study of the Americas and a professor at the Miami Miller School of Medicine. They have extensive biographies. I welcome you to go to our event page to read them. They're certainly very impressive, and we would probably take up the whole hour if I was to read through all of them. As the coordinator of the healthcare series, I am really delighted to be moderating this public sector response following on from the private sector perspective. And I want to say once again, thank you to our healthcare sponsor series, Sanofi, Pfizer, Merck, and Roche. Without your support, this wouldn't be possible. Just a reminder to everyone to keep your mics on mute so that we avoid any background noise. And from anyone joining now, please follow us online as well. Our hashtag is healthcareASCOA, and our Twitter account is @ASCOA. We will begin by asking each of the speakers to offer brief remarks, and then we'll go into Q&A. There will be an opportunity for all of you to ask questions. Please send them to me or Eric, and we'll be sure to include you in the conversation. So to kick things off, James, Dr. Fitzgerald from Hugo, would you like to begin by offering some brief remarks? Thank you.
So thanks very much, Zoe. Thanks to you and the council. To my colleagues, Fernando and Felicia, pleasure to be on the panel with you. To all the participants, a very good afternoon. We are in the unfortunate situation now of being the new epicenter of the COVID-19 pandemic. The first case in the Americas was reported on the 20th of January in the United States, followed quickly by Brazil, the 26th. But since then, we've seen a rapid spread of coronavirus throughout the region. It's now present in all 54 countries and territories of the region. Since then, PAHO has activated our country and regional incident management systems to provide direct emergency support to all the ministries of health, and the implementation of cross-sectoral preparedness response plans. We've been working arduously. We've implemented and adopted over 70 guidance documents for countries. Through our incident management team and the strategic fund, we've provided over 14 million PCR tests at this stage to the region. Supplies in the order of $120 million, shipments of 26 countries of PPEs. And you can see it's a really all hands on deck response now at this moment in time. Given the current context in which we find ourselves, I really wanted to focus on three particular points in this introduction. First of all, I think something to reiterate what we heard from the first panel. This is not only a health crisis, but it's a social crisis and an economic crisis within the region of the Americas. The health systems within the region of the Americas have essentially been laid bare through the lack of consistent investment in health services and health systems through the last decades. And whereas public investment in health has increased from essentially 3.8% over I'd say 2014, it's only at 4.2% if we exclude private investment at this point in time, which is well below the benchmark that we've set for countries, which is essentially 6%. What we've seen associated with this is the corresponding lack of access, geographic barriers to access, financial barriers with very high level out-of-pocket expenditures for healthcare, cultural barriers, administrative barriers within our health systems, fragmentation, segmentation persisting, that really the emergency response and the provision and organization of essential health services throughout the region. The sector also has not been without impact. We've seen an enormous reduction in an impact within the private providers, specifically the small and medium-sized enterprises that, due to the pandemic, have seen a considerable reduction in patients seeking care as a consequence of the pandemic. But one of the messages here, I think, that we are really trying to push forward with governments is that if you don't invest in your health systems, you can never be prepared. If you don't transform health systems towards the achievement of universal health coverage in normal times, You will never be able to instigate the response required in such an emergency, in such a public health emergency. I think the second question, the second message I wanted to leave here is with regard to the either-or proposition. Sometimes at the national level and even in global health, we see a pendulum swinging between emergency response and a more standard or normative development processes towards the achievement of universal health coverage. We've seen it in Zika, we've seen it in Ebola, and now we see it in the COVID-19 pandemic. And really what we're seeing is a false dichotomy here, a false choice between an emergency response and building and investing in health systems. What we see is also a false choice between the need to address the COVID-19 disease itself, the manifestations of that disease, and the provision of essential health services. Whereas what we need to really be doing is to be looking at adaptive, responsive healthcare systems that have the capacity to really reconfigure, reorganize, adapt to whatever context, whatever external threat exists, be it a natural disaster or a pandemic, as we've seen. I think one of the key resource inputs that we have seen, and I think we must acknowledge the enormous contribution of our healthcare workforce throughout the region. They have really been the core pillar of the response, and I think kudos to them for really standing up and supporting the response capacity. We are convinced that a strategy based on primary healthcare, healthcare based within the community, and that includes community health surveillance, participation of communities within decisions relating to the organization of healthcare is critical, not only in terms of the provision of core services, but also in response. So this issue of the false dichotomy, I think, is something that we really need to hit home in messaging in the future. The final message, I think, in these opening remarks I wanted to leave was around the fact that this provides us with an opportunity, and an opportunity to reset and prioritize transformative action, not just in the healthcare sector, but also in the social sectors. Here we need to look at this from the equity lens in terms of vulnerable populations, addressing the needs of those vulnerable populations, whether they live in poor peri-urban areas or remote areas, whether they're elderly population, indigenous, Black communities. These populations have been adversely impacted with regard to this pandemic, as they are traditionally also left behind in terms of access to comprehensive healthcare in the region. Core to this also is the development of social protection mechanisms in health. I think we need to begin to look and really push the message that developing integrated, comprehensive healthcare policy has to go hand in hand with developing social protection mechanisms so that we can protect people moving forward. They are really my key messages. I think any movement at this stage, as we look forward into the future of healthcare delivery, has to be built on the transformative action towards the achievement of universal health coverage, but has to build social protection mechanisms along with inclusive economic policies at the national level. Thank you.
Excellent. Thank you very much, James. And yes, you're absolutely right. This has really shone a light on the need to invest into the long term so that we can prevent and mitigate against the impact of any future health crises. And I also want to echo your words of admiration and encouragement for the healthcare workers who have been at the front line and the need to invest in building that capacity in the region. And also, this just also shows the link between health and economy, and it is seen as an investment. So now with that, I want to hand over the floor to Fernando Regalia, the Chief for Social Protection at the IDB. Over to you.
Thank you. Thank you, Zoe. Can you hear me well?
Yes, we can.
That's great. Thanks very much. It's a great pleasure to be here with you today, and honor to be with James and Felicia. They know much more about the health sector in Latin America than I do. But I also was very interested by the previous panel. Most of the things actually that I wanted to say are already said, but I'm going to try to maybe give a slightly different twist. It's very, very interesting. The previous panels as well. Excellent interventions. So let me add a little bit more to what James already said. This is truly, as James said, is Latin American Caribbean is now the center, the epicenter of the crisis. 42% of the new cases, confirmed new cases, are in Latin America as of today. But also true, the situation is not homogeneous across country, and there are different performance across different countries in Latin America. And I think pre-existing dimension of inequality between and within countries, for example, on the dimension of population effective access to healthcare or living condition, labor informality, housing, access to sanitation and water, are determining a different path. The region is not completely uniform. And we see it. There are countries that, for example, have very high accumulated cases, but still extremely low fatality rates. So we see difference in this country, and they're due to these pre-existing conditions, and also to the stewardship and governance of the crisis and the effectiveness of public sector institution in dealing with it. The IDB, as a multilateral financial agent, actually very early the crisis has concentrated their efforts in 4 main areas of work. And James have already alluded to social determinant and social factors. 2 of these areas of work that where we try to mobilize financing for the region were certainly supporting response, public sector response to the crisis, aligning to the pillars of the WHO strategic preparedness and response plan, but also trying to support income and consumption of a vulnerable population. And unfortunately, this pool of population has increased enormously because not only among the informal sector workers, there is a lot of destruction of employment, but also among sector formal worker. And therefore, the coverage in some system, actually, they lose coverage when they lose their work. So we actually concentrate on this line of work in order for some also non-pharmaceutical intervention like lockdown, general or partial, to be able to exist. People need to be supported in their purchasing power and incomes. And overall, just to give you the magnitude of the response in these 2 areas, this year we are going to basically lend half of our entire lending to these 2 areas. This has also been, I have to say, I've been in the business for a while. There have been some very positive new elements that come to play. We all realize that the scale of the crisis is too huge to manage, let alone without all hands on deck. And this has been particularly refreshing in terms of the level of cooperation and partnership to support the countries in the region to deal with this pandemic. I want to mention 2 areas in particular. One in the area of procurement. All the audience know better than me the big disruption in the supply chain, in the markets, for the inputs and all the inputs needed for the response. And actually, it's been particularly interesting to see the partnership forming with PAHO, with the WHO supply chain task, with COMISCA, with other UN agencies, with, for example, public financial management agency in the country, to really to try to overcome this huge issue of procurement for equipment inputs and all what it was needed for the response, and still with the big challenges as of today. The second is in the area of digital solution as well. I think there is a big delay in many countries in Latin America for this digital transformation of the sector, and that's very, very evident in the response. But all of a sudden, we discover that things can be done much faster, and so together again with many partners from the public and the private sector, we work on public health surveillance platform, management of critical inputs for health, contact tracing application, the telemedicine platform and remote training for health personnel. And there is a high demand for that. So this gives us hope that this partnership and collaboration can actually work going forward. And I would like to highlight four, in our opinion, four great priority. First is that we need to defeat this threat in the region. So partnership are going to be absolutely needed in order to allow equitable distribution of therapeutics and vaccine when they become available. And this should be the path then for even an investment in more robust public health system. And certainly we are following very closely the steps that have been taken by WHO, CEPI, Gavi, and other actors. The second, I think in the first panel has already been mentioned a lot, the digital transformation of the health sector. It is evident to everyone that data for decision making really made a great difference for those countries that actually had them and could manage in digital form to manage all the complexity of this crisis. And this is not just stopping today. When we're going to enter into the phase of perhaps what was called, I think, the hammer and the dance, that is going to be even more important. And what we observed, and we have a lot of demand for financing now, is expanding rapidly telemedicine and telediagnostic, let's say, virtual medicine platform. This actually has happened during the crisis in countries where you already have, let's say, from the normative and digital infrastructure, much more progress, but also in countries where this is not yet there. Yet countries are already initiating that path, and hopefully that will continue. I think there are two major issues there. One is of competencies of human resources and training, because I think, if I'm not mistaken, there is just one master in health information system in the entire Latin America. The third area has already been highlighted by the panel previously, which is the disruption in demand and supply of essential services. And that is really key. Even in operational or financing, as of today for COVID response, we're already putting quite a lot of financing to ensure continuity of care for maternal, neonatal, and child health and chronic condition, for example. I think we need to apply to those aspects the same urgency that we discover is there for COVID. When we talk about test, trace, and treatment or isolation for COVID, the 3T, actually this should have been done and should be done also for NCDs, which is screening and then follow your patient, right? So we discovered that the speed of learning and innovation has been much faster. So why not to apply to these challenges? And then the last point I want to make is the issue of standard of quality of care and management. I think all over the world was absolutely, I'm not a medical doctor, I'm an economist, but it's absolutely incredible to see the level of collaboration to really break barriers and learn fast about how to even treat clinically this disease. I think that has to translate to much more emphasis on quality of care and standard of care going forward. In an environment which is going to be extremely difficult because the macro fiscal situation in many countries is absolutely compromised, not just in terms of fiscal deficit, but also in terms of very high debt level that will jump after this crisis. So the environment to ensure sufficient investment in health is going to be particularly challenging. Thanks very much, and this we're open for the question and interaction. Thanks.
Great. Thank you very much, Fernando. And thank you for highlighting one of the bright spots. Despite the crisis, the disruptions and the need to act urgently has also shown that collaboration is possible in the level that it's been occurring across the region. So let's hope some of the lessons learned can stay beyond this, and that they can be, perhaps some changes to regulatory environments, and that the enablers can indeed stay in place. And with that, I'd like to hand the floor to Felicia Knoll from the University of Miami. She's held senior positions in governments in Mexico and Colombia, and she also has experience in World Health Organization, the World Bank. So over to you, Felicia. Thank you.
Thank you so much, Zoe. It's such a pleasure and to be able to join you and also to be with my colleagues and friends, James and Fernando. And let me say that peonies are my favorite flower, and you have a lovely background. Am I right? Beautiful. They're blooming in DC probably now. So following up a little bit on what my colleagues have shared, we know that right now it's the epicenter, that although Latin America and the Caribbean hold just over 8% of the world's population, on a daily basis, we're talking about 40%, more than just over 40% of deaths. And the first question is, why is it that Latin America has become the world's epicenter? And to some extent, I think we saw this coming, in a sense, almost like sitting ducks. This is the part of the low and middle income world that has probably the fastest aging process. So we certainly have a large group of older individuals over age 65 than many other regions. We're also sitting in a region where some very repressive regimes, a lot of conflict-related migration. And then we had very weakened health systems to begin with. And in some cases, and I'll highlight Mexico, the country I know best, where unfortunately just before the pandemic was going to hit, there was a major health system change, which was bound to generate quite a bit of chaos and leaving the country without, which was their Seguro Popular. So we left the region, we start with the region that's very at risk of what we're seeing now. And then we saw countries, big countries, with either no policy or a policy that was not evidence-based or a policy that went against evidence. And that left countries in the hands, we think, of not so much the federal policies, but the state level policies. And Zoe and I spoke a little bit, and she said that I could share a couple of slides on one of our projects right now. So if I can, I will. Zoe, can you see that?
No, I'm unable to see your screen at the moment.
That's interesting. It may not let me share the screen. No, it won't let me share the screen on Cisco.
Okay, I'll just ask Marvin if you're able to let Felicia share her screen. That would be most appreciated. Thanks.
If not, I can go back through it, but I should be able to.
Sure, perhaps you can, if you want to send it to us, we can try to share it on our end.
For sure. So you know what, because we've got such limited time, let me just, I will talk it through and send them. I think that's probably the best way to do it.
Thank you. And I'll send it to all the participants. And
that's fine. That'll be fine. So no problem. So what we're going to share with you is a state level observatory of public policy responses and mobility. The point is that we are now able to look at the state level and to see an enormous variance between states that are poor performers and states that are weaker performers in terms of applying necessary social distancing and public health policies in the region. And that, we think, is probably the area of greatest hope for countries like Brazil and Mexico in particular. And greatest hope because we think that we can ask those state level leaders that are not implementing the policies that were required to be able to step it up and think about both the public health and the physical distancing parts. Now, as far as we know, there hasn't been very much measurement at the subnational level of what countries are doing. And because we're seeing, particularly in Brazil and Mexico, that are basically holding the hands of the pandemic right now, that national policy is not functioning, we need to think about disaster preparedness at the state level. We're also especially concerned with the fact that we're beginning to see an opening up, so a relaxation of those physical distancing policies at the same time as we're seeing an upward swing, a peak, pre-peak actually, in Brazil and Mexico, of death rates and probably cases as well. Our case data is much less secure, I think, than our data on mortality. So the question is, what do we tell states to do, and how to strengthen state level governments to be able to respond to this? And this is why we think that state level preparedness is so important in this case. And when we speak about state level preparedness, we think about the financing side as well as the policy application side. And as they're opening, we think, having seen also what we're viewing on screen in the US, which is that they're not adopting public health policies like wearing masks, like social distancing, that we need to encourage our state leaders to be able to enforce that at the level of the population, as well as to, the more appropriate thing, encourage it through public health and education measures. Also, I think there's something that we should think about, it probably is one of the sets of questions, maybe in the rest of this webinar, is that there's a collateral damage issue. We know there's a trade-off between the health and the economic parts of this, but we also know that there are a set of key issues related to collateral damage. And we're especially worried about things like gender, about increases in the risk of domestic violence and other kinds of violence against women and children, as we see increased unemployment, increased levels of poverty in the region. So to ask what can be done to deal with the collateral damage that is going to happen as the result of the appropriate implementation of those public health and distancing policies. And maybe with that, I'll turn it over to the discussion.
Great. Thank you very much, Felicia. And just a reminder, we will send the presentation around and the links, and apologies that didn't work, but thank you. Thank you for your comments. Just a reminder to everyone online, please feel free to send me your questions. And Felicia, I just wanted to pick up on something you just mentioned about gender and the disproportionate impact that the pandemic has had on women. What is the need for gender transformative policies, and what is the role of gender and the empowerment of women before, like during or after the pandemic? If you could just share your views on that. Thanks.
For sure, and thank you. There's been a lot of discussion about how the mortality figures are hitting men more than women. But we know, particularly in three areas, we're at risk of seeing a pushback, decades of loss in what the world has seen in terms of moves forward on gender equality. The caregiving role, the employment role, and then the issue of being exposed to increased levels of violence. And I think one area that we could specifically talk about here, thinking about the future of health systems, and we could learn about, is the issue of the under and unemployment rates that we see among particularly female physicians. So in the region for the last 10 or 15 years, we've seen that the majority of people who study medicine are women. Yet we have issues like 40% under and unemployment of female physicians in Mexico from the studies that we have. That means that we have populations without physicians and physicians without work because of their gender and because of their other roles that push them out of the labor market along the way. When we talk about gender transformative, I think we need to think about changing the residency rules, using things like telehealth, and being able to bring in that incredibly important human resource, which is women in the medical workforce and overall in the health workforce. So I think that's one key example. Another point that has me very concerned is what we might call unprotected caregiving. What we didn't see in high-income countries were a lot of people dying in their homes with COVID. And we will see that in Latin America and the Caribbean more and more. Dying in your home with COVID with a caregiver who's almost always a young woman, reproductive age woman or an older woman, but a woman is there and completely unprotected with no PPE access and then dying in the home. And so how can we help to support those women in terms of the extra burden, yes, in terms of their time, but also their very increased risks of the virus because of this kind of exposure?
Thank you very much, Felicia, for talking about that important issue. Now I'm going to go back to James Fitzgerald. It's a question about resource management. In the context of rising prices and rising demand, how do Latin American countries get necessary supplies? And do they need to coordinate? And what is the role of PAHO in this? Perhaps you could draw on the PAHO Strategic Fund and PPPs. So over to you, James. Thank you.
Okay, thanks, Zoe. That's probably one of the one of the biggest challenges probably the countries have actually faced within this context. We've seen demand for PPEs, in vitro diagnostics, ventilators, other biomedical equipment completely outstrip supply, not just in the region, but globally. We find countries competing against one another with resultant price escalation. Another issue I think that countries have been challenged with is that the largest suppliers and manufacturers have been concentrated in a few countries that have implemented also supply restrictions. And so that has complicated access as well to those supplies. Implementation of advanced payment conditions being sought to commit to supply. We've had quality issues with falsified or substandard products circulating. And basically a failure in the global supply chain that Fernando mentioned, which is impacting transport. I think the smaller countries are being particularly impacted by this because they don't have the adaptive capacity or the purchasing power to secure supplies when they need them. So we have been working with our colleagues in the IDB, with Fernando and his team, with WHO, with UNICEF and Gavi, through the UN Supply Consortium. And this is a supply chain task force that's been established globally that has gone out and begun to align demand forecasting with current availability. So we've done that with our countries, coordinated also through WHO, availed of all the additional financing that Fernando has mentioned, that countries are freeing up for this, either through the international financial institutions or through just domestic financing. And just last week, we had an emergency meeting of our executive committee to inject an additional $50 million into the strategic fund so that we can immediately commit, once we identify a source, that we can commit to the order without receiving funding from the country. Because what we've seen is that by the time we try and broker that arrangement between the supplier and the country, the order is already gone, the supply is gone, because it takes time for the country to send the financing in. And so we've used the strategic fund mechanism as an emergency loan mechanism to secure orders, to advance payment. And we've linked in then very closely with our quality team to decide what is a quality product and what is not. And so that's the kind of actions that we're taking. There is enormous demand. Many countries are resolving this issue by themselves. Some are implementing testing strategies and the use of antibody tests that perhaps we would not recommend. We are sticking with the PCRs at this point in time until we have availability of both sensitive and quality products for antibody testing in the region. And so as we scale up, as I said at the beginning, as we scale up the capacity of our labs, there is a particular need for really coherent testing strategies to be implemented that aligns them with the forecasting needs. So it's a complex issue, but we have a whole team dedicated to work with that through our country offices and with the manufacturers and suppliers.
Thank you, James, and it's inspiring to see that there has been, relatively good views in terms of how quickly PAHO and IDB has been able to respond. We're just wondering, have you seen an increase in levels of corruption associated with fast-tracking public health priorities, and how do you think we can reduce that across the region? Perhaps a question for you, and also Fernando, if you'd like to jump in as well.
The issue of corruption is not something that is new to the world of COVID-19. It's a systemic issue, I think, throughout public procurement and in fact all health systems. So I would say to the issue of the specific issue at this point in time, although we haven't seen any specific cases of it, I think the region does need to increase the level of mechanisms to ensure transparency, to update the procurement legislation, laws, procedures, and regulations, and to implement the necessary oversight mechanisms that provides that level of transparency. We are in emergency situations, so this may be occurring, but we haven't seen any particular cases of this. But it's a general comment to I think, countries to strengthen the regulatory frameworks in this regard.
Thank you. And I think, Felicia, if you wanted to jump in there, and then we'll give the floor to Fernando. Thank you.
Just to say that I think this is an incredibly important issue that we did not see in the earlier phases of the pandemic, again, in higher income countries. So unfortunately, I have had a personal case. And I think there's an important health message here for providers. The family members who are stuck outside of the hospitals, desperately fearful about what is happening to their loved ones inside our hospitals, are exactly that, desperate. So we have cases now of people telephoning and begging us to help them to get a ventilator into a hospital where they don't have access for their loved one. Getting the ventilator means that they're buying that ventilator on the street. So there are people taking advantage in front of the hospitals, which I'm not unfortunately surprised about, of family members who are suffering. And the answer to that, I think, is that the hospitals need to have appropriate information outside and support the family members in telling them that purchasing on the street is not going to help them to gain access for their loved ones who are in the hospitals. I just think that's extremely important, and that's something that hasn't been discussed very much.
Thank you, Felicia. Fernando, did you have anything you'd like to add on any of the previous questions?
Just in line with what James said, I think it's an item risk. We have been taking a lot of internal measure so that no matter the fast track processes we have adopted, we have mechanisms actually strengthened both on the technical side and on the financial side for this auditing. The issue of partnership as well has been extremely useful. Such a distorted market, for example, if you want to really understand the price dynamics, sharing information like it's happening has been key in order to understand the movements and the pattern that we observe in the market because of this very distorted market. So that is certainly something we're paying very strong.
Thanks very much. Now, I just want to shift the conversation a little bit just to investment into healthcare. This pandemic has shown the urgent need to strengthen health systems in the region and the imperative to increase investments in this space. Given how prominent the topic is on the political agenda, do you, as our experts, see an opportunity to increase public health spending? PAHO currently recommends 6%, and however, despite potential reductions to broader public budgets as a result of the economic crisis. If you could just share your views on that. Thank you. Perhaps who wants to jump in first?
Okay, Zoe, I'll jump in first. We use this 6% as a benchmark. This is a benchmark that the countries themselves adopted way back in 2014, a benchmark in terms of public expenditures in health. And aligned with that benchmark, they also adopted a similar benchmark to reduce out-of-pocket expenditures to 20% of total health expenditure. So if we look at the countries in the region, there are essentially 5 out of the 31 countries that meet that criteria, which is an indication of where the region is in terms of where they are in terms of making the necessary investments into health. This, I think, this pandemic, it is obviously a wake-up call for us all to the importance of making those necessary investments. But as Fernando mentioned, the region is now entering both into a monetary and a fiscal crisis, where there will be significant reductions in terms of income generation for, while fiscal pressures and increased levels of debt will really impact the ability to make those necessary investments. So it's going to be a real dilemma. We are going to be urging counter-cyclical investment as the way forward, just to mitigate against the longer economic impact, to make the arguments with evidence that from, I think, more than anything from outside the region, to show that making that counter-cyclical investment in health systems and in social protection mechanisms, those safety nets that we need, will actually shorten the period of the crisis and will allow for a quicker recovery. That's a difficult argument that's going to be made, but I think within the context of COVID-19, it might be an argument that's easier to make. Because again, if our health systems are not prepared, well, then we've seen what can happen. I think one of the good things about this is we have seen that the health ministry has always taken a lower seat, I think, to some of the other sectors, particularly with regard to financing the economy. But I think what we will see is a repositioning of health, hopefully within the cabinet level, for it to be prioritized, not just in terms of provision of healthcare, but as a human security issue as we move forward. This is what we would at least like to see.
Thank you, James. And Fernando, you're the economist in the room. If you'd like to
let me actually try to be optimistic. So the truth is, right now we have some presidents in the region that know more about the Ministry of Health about health. So we really need to exploit that momentum. I think collectively, even if perhaps the first order of magnitude of increase is maintaining what was the pre-level crisis expenditure. And then I think the second issue, we need to collectively convey that some capital investment are needed in order to transform some line of care in particular. I heard before in the previous discussion the fact that telemedicine and telehealth, etc., is cost effective. Well, the truth is there are not many studies out there saying that. And there is some upfront investment needs to be done that need to be justified. And this is the moment in which those analytics and empirical figures are important, because some additional capital investment will need to be done in a context in which there will be very little resources for additional capital investment. Digital infrastructure is not as expensive as maybe some other type of infrastructure, but it could be. And therefore, this case has to be made strongly right now to benefiting from this evidence that this priority has been done by presidents as a result of this crisis on investment in the health sector.
Thank you very much, Fernando. And Felicia, did you want to add any comments on healthcare financing?
Sure. Well, I think two thoughts on this, and I'm actually also an economist by training or mistraining. The first is the one avenue to help to facilitate more investment in health is to open the economy in a safe way. And when we relax physical distancing, again, I think what we're saying is that in a safe way means encouraging the population to adopt certain habits that they're not used to adopting. What we've seen, again, from the US is that this isn't a very easy thing to do, although much more success in Europe. And I think asking how we can make that happen in Latin America will help to push the economy forward in a much safer way, avoiding, which would be the worst option, and which I think we're moving towards now, where you open, people congregate, and you're going to see increased spread of the virus and increased demand on health systems associated with the virus. We've got to try and do that safely. And the other is, I think we knew some things before that some governments decided that they didn't understand, which is that we want to have public financing of a health system, and we want to separate financing from delivery, and we want to have plurality in the delivery of care. And so going back to those basics, which I think are the key to an equitable, efficient, and effective health system, is where I think we need to go.
Thank you, Felicia. And I think some of your comments just highlight the importance of political leadership and evidence-based health policy. And I think throughout the region, you can see varying degrees of success in terms of public health measures to cope with COVID-19. Now, before giving the participants on the call a chance to ask questions, I just have one for James from PAHO. Given that vaccines are high on the agenda in terms of a solution, or at least how we're looking towards the future. Will PAHO be collaborating with Gavi for a potential COVID vaccine? If you could comment perhaps on global pool procurement. I know we have many pharmaceutical companies on the line. I was wondering if you could comment on that. Thank you.
Yeah, sure, absolutely, Zoe. And the answer is, yeah, we are already collaborating, both with WHO and with Gavi. As you know, Gavi will be launching the COVAX facility tomorrow. And this is the Gavi-led initiative that will be looking at how best to structure and organize an advanced market commitment to ensure access to vaccines, probably initially based on a base price, and thereafter looking at some form of tiered pricing. In our discussions with Gavi, we've had really positive discussions with Gavi around the issue and the use of the regional revolving fund for vaccines. One of the issues I think that we'll be looking at is in terms of how the vaccine and what technologies will be coming out. We know that there are over 100 products in development. So will these products be produced by and will manufacturing be centralized, or will we be implementing a bulk filling process throughout the region, which has different regulatory implications as well for the region? So we're aligning with our regulatory team, our revolving fund team, working with Gavi very, very closely. And we're also working with WHO on these principles of equitable and fair access, which is going to be a big issue, I think, how we ensure equity and fair allocations for a vaccine once it arrives. This is really going to be a core issue moving forward. But we're confident that our collaboration with WHO and Gavi will be productive for the region.
Thank you so much, James, for highlighting that cooperation with Gavi and others, and we appreciate your response on that. I'd like to hand the floor over to Rolf from Roche. He has a question for the panel. So Rolf, over to you.
Yeah, thanks, Zoe. And I think what I wanted to ask is if I looked at the panel that we had on the private part, and I think we are all working or talking about the need for collaboration, the private and public sector. And I wonder, what is the view of the public speakers? How do you see the potential of the private and public collaboration in order to make the healthcare systems better for the longer term?
If our panelists would like to respond to that, I think this applies to all of our panelists. So, Fernando, if you'd like to go first.
I think the knowledge of the private sector is absolutely enormous. during this crisis, we have been, for example, I'm talking about the digital space, been able to navigate with our private sector arm, BidLab, a lot of work with private sector companies in order to introduce even sometimes pro bono solutions that could be tested in countries, trying to navigate the difficult conflict of interest procurement issues. And I think this is has taught us a lot to work with some of this company, because we were able actually to support under the leadership of the client, which in my case is our Ministry of Health, so it's public counterparts, adoption of technologies that probably will then be scaled up. So I think this is we are learning how to do it, and I think ministries are learning how to do it in this space, while respecting the procurement rules and the conflict of interest risks that need to be managed.
Okay, and James from PAHO, if you'd like to also share your comments.
Yeah, thanks, Zoe. Yeah, I think the private collaboration, the partnership with the private sector, particularly within the context of this pandemic, has been tremendous. As we rolled out what we call the in-house protocol, the initial testing protocol for coronavirus, we saw the private sector and how they really leveraged their innovation capacity to produce PCR tests based on open and closed platforms, scale up. I mean, all this would not have been possible. And really, I think there should be really tremendous recognition of the work that they have done on that. And as Fernando has said, in terms of the telehealth space and the digital transformation for health, this is all leveraged off the innovation that has occurred in that space as well. I think one of the challenges we probably continue to face is in healthcare delivery with the healthcare service branch, the healthcare provision branch of the healthcare sector. We have seen some complex situations evolving in some of the countries in Latin America about the participation of providers, private sector providers in the response. Some degree of reticence, I would say, to have a whole of health sector response as opposed to just the public sector or the social security sector responding while the private sector continues to do to work as it does. But within a context where you need ICU beds, hospitals, reconfiguration of services, I think in general we can recognize that the private sector services have also contributed very effectively in this area. It will be, I think, an item for discussion moving forward in the region in terms of oversight and regulation within the context of an emergency, in terms of how the private sector supports the capacity of the state to be able to respond with regard to healthcare provision.
Thank you very much, James. And Felicia, over to you if you'd like to comment.
So I think first, some on-the-ground examples that what we saw in Mexico, a country where the opportunity for private-public collaboration has been limited in many ways, is that in the face of the pandemic, the private sector actually stood up to push government, both at the state and the federal level, in a way that I thought was truly incredible and very innovative. And as a result, we've seen some very important and interesting collaborations. And the example, I think, in Mexico is the Mexican Health Foundation, which is purely, financed and set up by a large group of private sector companies and individual financial leaders who support that institution as a think tank. And that institution is actually now playing a key role in managing the movement of patients between private and public sector in response to COVID. So it was a chance for private sector to stand up, their think tank to stand up, and they did exactly that. But moving forward, I really think that it is all about the separation of financing from delivery, that we need better ways, and we know what those are, to be able to integrate the private sector on the delivery side. And finally, just to mention, James hasn't said, I think, as much about it, unless I missed something. But the PAHO Strategic Fund moving forward, there's excess mortality because, and I think it was Fernando that mentioned NCDs, these have been set way back from where they were before, less screening, less access. And one of the things that I think we can really step up is using something like the PAHO Strategic Fund to be able to have better access to cancer medications. I want to highlight the need for opioid medications for COVID and for others. But I shouldn't talk about James's fund. It's really that's his design, and he's pushed that forward so much. But I think that's a huge opportunity to get public-private collaboration and access.
Excellent. Thank you so much, Felicia. And thanks to our panelists. I think, one of the key themes that has come out is really the need for collaboration, that's key to charting a path forward. But perhaps also we see the economic impact of underinvestment into health. So perhaps as another outcome that, we could look at as well through the healthcare series is an innovative framework with health and finance ministers to work more closely together, as well as government and private sector. Before we close, I just wanted to mention that one of our upcoming events will be with Julie Gerberding from Merck, and she's the former director of the Centers for Disease Control and Prevention. And that's, one of the ways in which we'll be looking at, lessons learned from COVID-19. And I think that the panel today has done such a fantastic job. And now I'm going to hand over to Eric Farnsworth. He's going to do the final closing. But before that, thank you to our panelists. You've done such a brilliant job, and I'm sure we could stay on for much longer. There is so much to discuss. But for now, a virtual round of applause to you. Thank you for joining the healthcare series. And Eric, over to you to do the closing. Thank you.
Thank you, Zoe. I think virtual applause these days, what is it, snapping our fingers, or I don't know what it is, but congratulations and thanks again to all the panelists. What a terrific job from your perspectives. There is so much more to discuss. We just don't have time to do it. But a couple very quick things to thank Zoe for her really outstanding moderation of this program, to thank again our sponsors for their support, and to encourage those of you on the call who may not be sponsors to consider sponsorship of our activities. Goodness knows there's a lot more to discuss here, and with your support, we will continue to get to some of those issues. So if you're interested, please contact either Zoe or me or anybody at the Council of the Americas. And my final thought is this, that, throughout history in Latin America and the Caribbean, crises come, crises go. And it seems like in every crisis, people talk about, how we're going to come out of this and build better, and we're going to have key learnings and incorporate best practices. And all of those good intentions are terrific, but good intentions aren't enough. And the question is now, together and based on the outstanding interventions of our panelists, how can the public and the private sector come together coming out of COVID to actually address these issues that we've all been talking about? It requires leadership, it requires resources, it requires goodwill, it requires trust, all the things we've heard. And so it's our encouragement to continue along this path. The Council of the Americas will continue to lead efforts from the policy side on some of these activities, along with others as well. And so just simply to thank everybody for joining us for this discussion. There will be many more to come. With that, Zoe, I believe we are concluded, and we will see everybody hopefully in the very near future, if not in person, virtually. So thanks again.